She can hear everything you say. She's on the headphones.
I'm not in trouble.
So I heard you're staying real busy.
Pardon?
I heard you're staying real busy.
Yeah, we're very busy.
That's awesome. Good to hear.
Yeah, we're doing really great.
Yeah, we've been... Oh, go ahead.
We just added 2 new providers a few months ago.
So how many do you have total now?
We have 3.
3, okay.
Yep.
Wow, that gives you a little bit of a break, but maybe not.
It does. I'm taking Thursdays off.
Oh, good for you. Good for you.
What's he calling it, John?
Yakima.
How's the weather down there?
How's the weather down there, Rick?
Snow on the ground, probably in the teens as far as weather, or maybe 20.
Yeah, that's about us here.
Yeah.
Looks like we've got about a minute now.
Okay. I've never done radio before like this. I've done a few commercials, so.
All right.
I'm just going to talk to you like I'm on the phone.
Absolutely, that's what we want to do.
I didn't want to speak the phone because that's
Stand by, we'll be coming back to you shortly.
All right.
You owe. The program at Total Financial Freedom can help you get debt-free in months instead of decades. Call Total Financial now at 800-899-8922. That's 800-899-8922.
Brian Clark, ABC News.
Hello, listeners and viewers. You are live at the AM 1470 KBSN studio with Health Solutions with Shawn and Janet Needham, where Team Needham discuss everything healthcare. Today, we have Dr. Richard Edgerly from Assurance Health out of Yakima on the air with us. If you'd like to join us, call in 509-765-1470. Also, my personal Facebook page at Shawn Needham's Facebook page and the Moses Lake Professional Pharmacy YouTube. So today, Dr. Richard Edgerly with a direct primary care practice out of Yakima, Washington. He is a pioneer in this area, and we talk about him and brag about him all the time. So we're going to get to hear from him for the next hour. Dr. Edgerly, how are you?
Yakima on the air with us.
If you'd like to join us, call in 509-765-1470. Also, my personal Facebook page at Shawn Needham's Facebook page and the Moses Lake Professional Pharmacy YouTube. So today, Dr. Richard Edgerly with a direct primary care practice out of Yakima, Washington. He is a pioneer in this area, and we talk about him and brag about him all the time. So we're going to get to hear from him for the next hour. Dr. Edgerly, how are you?
Yakima on the air with us.
If you'd like to join us, call in 509-765-1470. Also, my personal Facebook page at Shawn Needham's Facebook page and the Moses Lake Professional Pharmacy YouTube. So today, Dr. Richard Edgerly with a direct primary care practice out of Yakima, Washington. He is a pioneer in this area, and we talk about him and brag about him all the time. So we're going to get to hear from him for the next hour. Dr. Edgerly, how are you? Yakima on the air with us. If you'd like to join us, call in 509-765-1470. Also, my personal Facebook page at Shawn Needham's Facebook page and the Moses Lake Professional Pharmacy YouTube. So today, Dr. Richard Edgerly with a direct primary care practice out of Yakima, Washington. He is a pioneer in this area, and we talk about him and brag about him all the time. So we're going to get to hear from him for the next hour. Dr. Edgerly, how are you? Yakima on the air with us. If you'd like to join us, call in 509-765-1470. Also, my personal Facebook page at Shawn Needham's Facebook page and Moses Lake Professional Pharmacy YouTube. So today, Dr. Richard Edgerly with a direct primary care practice out of Yakima, Washington. He is a pioneer in this area, and we talk about him and brag about him all the time. So we're going to get to hear from him for the next hour. Dr. Edgerly, how are you? Yakima on the air with us. If you'd like to join us, call in 509-765-1470. Also, my personal Facebook page at Shawn Needham's Facebook page and Moses Lake Professional Pharmacy YouTube. So today, Dr. Richard Edgerly with a direct primary care practice out of Yakima, Washington. He is a pioneer in this area, and we talk about him and brag about him all the time. So we're going to get to hear from him for the next hour. Dr. Edgerly, how are you? Yakima on the air with us. If you'd like to join us, call in 509-765-1470. Also, my personal Facebook page at Shawn Shaw's Facebook page and news as the official post on YouTube. Today with Dr. Richard Edgerly, Dr. Billy campaign design to get your university needs in this area. And while you talk about your goals and attitudes and how to get there, read your experience, potential to get the right partners on your campus. Would you like to do this? These are the opportunities to as far as this page and news as the official post on YouTube. Today with Dr. Richard Edgerly, Dr. Billy campaign design to get your university needs in this area. And while you talk about your goals and attitudes and how to get there, read your experience, potential to get the right partners on your campus. Would you like to do this?
I've always said it's where I kind of know that membership. There is no other charges. I want to ward off the destiny of that membership. I take a lot of anxiety or worry that every time you come in, you have a physical investment to it. I have to show you what you can yourself, but at the time, I don't know additional charges. They also have membership for that membership. There is no other charges. Two parents, I ward off only $200 a take a lot of anxiety and our next segment, what I'd like to talk to you about, Dr. Edgerly, is how technology plays a part in all of this, because you leverage technology highly, and your consumers, your patients have really benefited from it. And I've got a great story that I can share about drug primary care also. So hang on the phone with Dr. Edgerly. You are listening to Health Boosted with Shawn and Janet Needham. We will be back shortly.
An open letter to the woman currently figuring out what to get her husband for Christmas.
Hi, honey, this is your husband. If you're thinking of just going with clothes again, that's cool. I'll roll with it just like I always do. But a Northern Quest gift card might be nice. Just something I can play with instead of, wearing. The way I'm already wearing the clothes that I'm wearing.
Get the gift of Northern Quest. Stop by or visit northernquest.com for details. We're going to talk about something inside Northern Quest for change. Alright. That's cooking at the lake at night. Yes, that boat was really floating up on top of that water.
I think that was because of I can't do that.
Serious about gaming? Northern Quest pays out more than 80 jackpots per day. Visit northernquest.com for details.
At Complex Health, we're dedicated to improving our patients' health by providing safe, high-quality care, close to home, primary care, family medicine, acute care, and specialists, all working together to not only keep you well, but help you live your healthiest possible life. We call it whole-person care, from folks you call your neighbors. World-class health care, close to home, near Complex Health. Make an appointment to find your primary care physician or earn wellness online at ConfluenceHealth.org.
ATM and Grammy Award-winning selling artist Susie Vargas wants to celebrate the holidays with you. Go to our Swingin' Little Christmas with Susie Vargas on Saturday, December 7th. Just after 7 p.m. Sister Release of 1982 features you ready. Susie will be playing one of the key artists that created golden day 1990s country with 6 top 10 singles and radio stations like Drive Some, King Cinderella, Letting Go, and I'm About You. Saturday, December 7th with Susie and her stellar Nashville band for a fun-filled enchanting evening of Christmas standards, sing-alongs, original holiday songs, and all the great hits for the whole family to love. For tickets, call the Columbia Basin Allied Arts 793-2059. That's 793-2059 to reserve your seats. Tickets will also be sold at the door. Don't miss it. A swinging little Christmas with Susie Vargas, brought to you by the Columbia Basin Allied Arts.
The end is near, my friends. 2019 is ticking down fast. If your 2019 resolution was to get
great internet at a great price,
you've timed your move to Northland perfectly. Northland's end-of-the-year pricing gets you 100 megabits per second for just $54.99 a month. You get all the speed you need for the life you lead. The end is near. The start of great internet is here. Go to getnorthland.com before the year and offer ends. Limited time offer. Additional restrictions and conditions apply. Go to getnorthland.com/offers for details.
Thank you for making Polaris America's best-selling off-road brand. During Polaris Great American Thank You event, you can get low financing and rebates as high as $3,500. That's right, rebates up to $3,500. See your Polaris dealer now for the season's best deals on America's best-selling lineup. High-performance racers, legendary sportsman ATVs, hard-working Rangers, or elevate your adventure to a versatile Polaris General. Your local Polaris dealer is Mountain View Polaris, 507 East 3rd Avenue in Moses Lake. The Moses Lake Business Association invites you and your family down for the 25th Annual Agriculture Appreciation Christmas Parade on Friday, December 6th, beginning at 5 p.m. with a street party down at the square. There'll be live entertainment featuring Voices of a New Day, Christmas music, hot chocolate, and Santa Claus will even be there. Then the parade kicks off at 7 p.m. For more information, you can call 770-1700. That's 770-1700.
Your house has everything you could ever want. A big TV, a home office, and plenty of space for the kids. And now, with all the home automation upgrades like your thermostat, lights, and security cameras, it's more important than ever to have fast, reliable internet. Upgrade your internet and switch to iFiber Communications. Gigabit internet for only $74.95. Call 509-761-3947 or visit iFiber.com today.
Hello, and welcome back to Health Solutions with Shawn and Janet Needham. In our last segment, we had Dr. Edgerly from Assurance Health out of Yakima on with us, and he is back with us. So let's continue that discussion. Dr. Edgerly, we were talking about technology and how you've leveraged that in your practice. Can you tell us a little bit about that? You know, like text messaging and video conference, things like that?
Yeah. So, thank you. So, our membership, of course, not only includes in our office, but it also gives you 24/7 access, 24 hours a day, 7 days a week access to the physician. To do that, of course, then we have to use the other technology. Maybe it's going to be the telephone. Maybe it's going to be, using the computer, etc. Either text messages, or we like to usually do it face-to-face, but we get both. That's also allowed us to be across state bounds. You know, we have patients that are in other states, Hawaii, Idaho, Oklahoma, believe it or not.
Amazing.
Patients that want our service, and we're allowed to do that with some of the technology that's available.
So let me give a story, if you don't mind, about one of your patients. I won't mention any names, but he's very close to me. He's actually my nephew, and we are in the middle of Montana, and he's actually, we talked about him on episode 1 of Health Solutions, and he forgot, he's type 1 diabetic, and he forgot his medication. So here we are in the middle of Montana. We're ready to go hiking with my family and my brother's family, and of course my nephew's with me. And I had referred my brother to your practice because he needed somebody to take care of his family, because he was tired of, he had a couple kids with some chronic diseases, and he was just tired of the mess that he had to go through in the healthcare system to treat a kid with asthma and to treat a kid with diabetes. So he went to your service, he went to your clinic, and the whole family went to your clinic, and he was extremely happy with it. We're in the middle of Montana, nowhere Montana, I can't remember the little town's name. There's one pharmacy in the town, a little independent pharmacy, and he had forgotten his insulin. So we go to this pharmacy, and of course, you know, I kind of have a little bit of an in because I'm a pharmacist, and I go back there to the pharmacist and I said, we're going to need some insulin today. Do you guys have, what kind of insulin do you have? And he did let us know what kind of insulin he had, and I said, and it was a Saturday or a Sunday, I can't remember, and I said, well, we're going to get a prescription called in for him. And they said, oh, that's not going to happen. I said, he said, the only thing you're going to be able to do is go to the emergency room today. That's the only way you're going to get a prescription for this kid. I said, no, we'll get a prescription. Anyway, my brother texted you, and next thing you know, they called the pharmacy, and we got a prescription. So we were able to continue our hike, and it saved us $1,000 in the emergency room, because we didn't have to go to an emergency room doctor to get his insulin refilled. So, I mean, that alone paid for the fees for months. So, yeah, and I'm sure you have lots and lots of stories like that. Another story I'm going to share. Same family. He had kind of a little bit of folliculitis or some kind of infection. my brother sends you a picture of it, and you recommend antibiotics, and he gets a prescription filled, and he's all, he's taken care of. Didn't have to take time out of his way to go. It was a weekend too, of course, so he would have had to go to a walk-in or an ER, and it just made it so much convenient. So thank you for what you're doing, Dr. Edgerly. You are really changing the world. I think this is the future of medicine. I really do.
Well, I hope it is. Direct primary care has already been proven. Now, I don't do the studies myself, but there are people that are doing that. That if you're a member of a direct primary care clinic, you decrease the ER visits by 95%. You decrease specialty visits by 65%, and hospitalizations by 35%. How does that work? Well, most people go to the emergency room out of fear or out of the unknown. Whereas if you can call your physician 24 hours a day, 7 days a week, and people don't abuse that, by the way. I think after the first year, I had 22 phone calls outside of the clinic in a whole year. That's less than 2 a month. That's not abusing it. But it's convenient. I think I have an appendicitis. I call the doctor. No, actually, your appendix is on the right side, not the left side.
Right. Right.
You don't have a fever, so you don't need to go in. Or, yes, I can meet you at my office because that's a laceration that has to be sewed up. But the number of times that makes me go into the office on the weekend is very, very small. And it's nice to have the ability to help people out of the clinic.
Well, I know one of the things that doctors that are wanting to do what you do, they're really fearful about that. It's like, what do you mean 24/7 access? There's no way I can handle all those calls. And here's one of the things I tell them. Most of the patients that you have that pay for that service, they work for a living just like you do. So they really respect that time. So if it's midnight and it can wait till 8 o'clock in the morning, they wait till 8 o'clock in the morning. So, and that's kind of what we see with this direct primary care model, is because people are paying out of their pocket. It creates a value to them. It creates a safety net, but it also creates a respect with you and them personally, where they're gonna still respect your personal time and only use that if they absolutely have to.
That's very, very true. I was just on call for the Thanksgiving weekend, so we closed the clinic a little early on Wednesday just to decorate the office for Christmas, and again Thursday, Friday, Saturday, Sunday. I had 2 phone calls. One of them was a college kid that was home, happened to have probably a strep throat. They had been seen at the college campus for a sore throat, was placed on an antibiotic, and they had gotten significantly better, but now the antibiotic ran out. They were getting worse, so they needed help with that, etc. And what people don't realize is physicians, our DEA license, which enables us to write prescriptions, is actually nationwide. So I can help that person in Oklahoma. I can help that person in Hawaii. And so it's nice to be able to help people, like I said, out of the office.
So you mentioned one thing about specialty. You decrease specialty visits. Can you expand on that a little bit? I know you and I have discussed this off the air before. So will you discuss a little bit, how do you prevent specialty visits?
Well, one thing is having a degree in family medicine. We can see pediatric children, of course. We can see adults, and we can see the elderly. A lot of the visits to the specialist, is mostly a time-centered event rather than a knowledge-centered event. For example, if you have name one, let's say a heart problem. Many of the heart problems can be taken care of by the family medicine physician. We take care of congestive heart failure. We take care of high blood pressure. 1 out of 100, let's say with blood pressure, may need to be referred to a specialist. Uncontrolled blood pressure. No matter what I put them on, 2 or 3 drugs, it's not working. Then they need a little bit better workup. One that I could probably do, but one that the specialist can certainly do more efficiently. Then we can make a referral. The other thing that happens is once we've made that referral and the specialist recommendations, then we can follow through on it. We don't need to have you go back to the specialist 3 times a year. We see this in Yakima, especially with rheumatology, for example. We don't have a rheumatologist, or if we do, we have one now. I think we may have just had one start recently, but there were no rheumatologists. So I would have to send them down to the Tri-Cities. They saw a rheumatologist down there, and then after that, there's monitoring, depending on what meds they put them on, there's monitoring with blood work. I can do that in my office.
Right.
And I can also, many times, just call the specialist. They would actually, a lot of times, prefer that I just call them and talk to them about the patient, rather than having to make a referral, get approval from Medicare, get approval from an insurance, someone else to see them in the office, whole billing process, et cetera, et cetera. They'd much rather me just get on the phone and say, hey, we call them curbsides. I got this guy in the office that has yada, yada, yada. I've taken care of him with this. It's not getting better. What do you recommend? It's a 5-minute phone visit rather than a hour-and-a-half process.
Right. And not to say, but a longer wait, too.
A longer wait, another deductible.
Right.
Another copay.
So speaking of that,
those are real things.
Absolutely. And so speaking of that, do you think that there's an overutilization of specialists, partly because of the insurance model right now, and it's just a way for another deductible or another office visit to be charged?
Absolutely. I'm really surprised at how many people go to the emergency room, let's say, and the kid fell down, hurt his arm. It's not an obvious fracture, right? And invariably, they leave the ER with an appointment to see the orthopedic surgeon. And I say, no, again, why do they need to see the orthopedic surgeon? It wasn't fractured. It was sprained. Or if it was fractured, it was what we call a green stick fracture. The orthopedist isn't going to do anything about that. They're already in a splint. I'll see them. I can cast them if I need to. Most of the time, we just watch them in a splint, take an x-ray, a couple weeks later to make sure it's healing. But there's no reason to see a specialist for that. And we see that with diabetics who now are sent to an endocrinologist. People that, left my office with a glycohemoglobin of 7, which is excellent, and happen to go into the ER for some other reason, invariably are getting sent back to a specialist that they really don't need to see.
Right. So I went to your website, and just for listeners and viewers out there, it's healthassurance.org. Is that correct, Dr. Edgerly?
It's actually assurancehealth.org.
Assurancehealth.org. Okay, thank you for the correction. So assurancehealth.org. And one of the things that you can get if you request it is you can get a little 10-page paper that Dr. Edgerly has written about, how you can save a lot of money on healthcare. And some of the things we've already talked about. We talked about, overuse of specialists. There's some other things on here. Facility fees. Dr. Edgerly, will you talk to us about facility fees? I know that's a hot topic. Educate the listeners about what facility fees are.
Okay, so first of all, I think the paper was written actually by my CEO, Jason Larson, and so I'll give him credit where credit's due, although we talk about these things all the time. I think he's the actual one that prepared that.
Okay.
One of those is facility fees. Now, where did those come from, and what are they about? Well, what happened years ago, even before direct primary care, is they took hospitals, this is they as in the CMS, Center for Medicaid and Medicare Services, and they recognized that certain hospitals saw a disproportionate share of poor people. Welfare, Medicare, for example. Those aren't always poor people, but you get the picture.
Right.
And what happens, since Medicare and Medicaid only reimburse at such low rates, Medicaid, about 25% of what the doctor charges. Medicare, about 30% of what a doctor charges. These hospitals were going broke. So they came up with this thought that if you see a disproportionate share of these Medicare, Medicaid patients, then we are going to give you money on the back door, money that's not based on fee-for-service. And now that has progressed, I'll use that word, into what's called the facility fee. So, for example, we had a clinic in our town that was internal medicine and family medicine. They would pay them a facility fee if a certain percentage of their clientele was Medicare, Medicaid. Well, they actually got rid of their family medicine physicians, put them in a separate clinic, so that the internal medicine clinic, which is predominantly Medicare people, could qualify for this facility fee. So now this clinic was able to charge, and it varies clinic to clinic, but it's about $100 extra for every time the patient came into the office. And now instead of paying $180 for your office visit, the cash pay and the insurance patients were now paying $280 for their visit. So Medicare actually picked up the tab on the Medicare patients.
Right. But so a patient like myself that goes into a facility like that, I would get charged an extra $100, even though I'm not on Medicare. I'd get charged an extra $100 facility fee just for the privilege of going in, walking in the door.
Yeah, because you're not on Medicare. That's exactly right.
Right. Okay. Thank you for clearing that up. So another thing you talked about was unnecessary procedures. So expand on that a little bit, and we might have to go to the next segment, but expand on that a little bit.
Well, there's so in the doctor's office, there's more than one way to skin a cat, so to speak. So let's take, how do I check for colon cancer? Well, I can do a flex sigmoidoscopy, which used to be done, and still is actually, in the physician's office. Or I can do a colonoscopy, which is basically the same procedure except for maybe 3 more feet. That's actually done under anesthesia now.
Okay.
And the cost, rather than being $150, is actually about $8,000, depending on, again, which facility you use.
Okay, Dr. Edgerly, can you hold that thought? We got to go to a quick commercial break, and then we'll be back in a couple minutes. You were listening to Health Solutions with Shawn and Janet Needham.
At Confluence Health, we're dedicated to improving our patients' health by providing safe, high-quality care close to home, primary care, family medicine, acute care, and specialists, all working together to not only keep you well, but help you live your healthiest possible life. We call it whole-person care, from folks you call your neighbors. World-class health care close to home. We're Confluence Health. Make an appointment or find your primary care physician partner in wellness online at confluencehealth.org.
The Politician invites you to live vicariously through the dirty politics of the filthy rich.
I'm going to be president of the United States. It does seem to be the hot job nowadays.
You simply can't afford to miss Ben Platt as aspiring future President Peyton Hobart.
I'm warning you, do not screw with my dream.
The iconic Gwyneth Paltrow.
Your ambition frightens me.
And the legendary Jessica Lange.
I might have psychological problems.
The Politician. All episodes now streaming only on Netflix.
Hi, I'm Jen. I'm a dog person.
I'm Clara, and I'm a cat person.
As a dog person, I wear Bobs for Dogs from Skechers because with every pair sold, Skechers makes a donation to the Petco Foundation to help save sheltered dogs.
As a cat person, I wear Bobs because they've already saved over 240,000 sheltered pets, including cats.
But I like that you can find Bobs at over 600 Petco stores.
I prefer to buy them online at Skechers.com.
Let's just agree that we both like Bobs.
Agreed.
Bobs for Dogs from Skechers. Available at Petco, Skechers, and wherever stylish shoes are sold.
CMA, ACM, and Grammy Award-winning and platinum-selling artist Susie Boggess wants to celebrate the holidays with you. Come join her for a swinging little Christmas with Susie Boggess on Saturday, December 7th at the Wallenstein Theater. Showtime is 7 p.m. Since the release of her 1989 major label debut, Susie quickly became one of the key artists that defended Golden Day 1990s country with 6 top 10 singles and radio staples like Drive South, Hey Cinderella, Letting Go, and Out of Bound Plane.
Don't want to be standing here with this ticket to this outbound plane.
So come join us on Saturday, December 7th with Susie and a stellar Nashville band for a fun-filled, enchanting evening of Christmas standards, sing-alongs, original holiday songs, and all the great hits for the whole family will love. For tickets, call the Columbia Basin Allied Arts, 793-2059. That's 793-2059 to reserve your seats. Tickets will also be sold at the door. Don't miss it. A swinging little Christmas with Susie Boggess, brought to you by the Columbia Basin Allied Arts.
Takes the shotgun snap, play fake, going to throw to the end zone, got a man there. Ball is tipped up and intercepted. Bradley McDougal in the end zone. The Seahawks are back in front of the 12s as they welcome the Minnesota Vikings in prime time. Hi, this is Steve Rabel Join me this Monday night. Pregame at 3, kickoff at 5:15, right here on the Seahawks Radio Network. If you can't make it to the game, you can catch all the action all season long, right here on your sports authority for the Columbia Basin, AM 1470, KBSN, Moses Lake.
Hello and welcome back, listeners and viewers. You are listening to Health Solutions with Shawn and Janet Needham, where every Monday, 1 to 2 p.m., we discuss everything healthcare. And today we have Dr. Edgerly on the phone with us. And if you would like to join us today, call us at 509-765-1470. Dr. Edgerly, you were talking about procedures for colonoscopy and such.
Right, so more than one way to detect colon cancer. So the basic thought now is once you turn 50, you need a colonoscopy. Well, there's other ways to check the colon. So, for example, the first thing we typically do is we do what's called a stool guaiac. And guaiac is a way that's spelled G-U-I-A-C, or maybe I missed a U in there, G-U-I-U-A-C. Basically, you're testing for hidden blood. You can also do that plus a flex sigmoidoscopy, which is fairly inexpensive, maybe $150 in a physician's office. I used to do those. The third way is to do a Cologuard, and this is where they actually send you a bucket. Basically, you defecate into the bucket, you send it back to them, and they check for abnormal cell types. And it has a negative or a negative predictive value of about 98%. So if it comes back negative, you don't have colon cancer, or you probably don't, 98%. Or you can do a colonoscopy. Now, the issue with the colonoscopy is you can have that done at the typical facility, and that's going to run about $8,000. What we do in our clinic is we provide that for $750 because we have found a provider, a gastroenterologist that does that for cash, not using the third-party system. So, true story, I had a patient that had insurance, and he said, I said, well, it's time to check your colon. You had a positive colon polyp, 5 years ago or whatever, that needs to be rechecked. And I said, I have a guy that will do it in the Tri-Cities for $750 cash. No, I have insurance. I expect them to pay. I said, okay. So we went locally. They charged him $8,200. $1,700 was written off because they were preferred providers for his insurance. The insurance paid $3,400. He now owes $3,100 when he could have had it done for $750.
Absolutely, and thank you for sharing that story. We need to get the word out. Let's just face it, health insurance is a ripoff. I mean, for routine stuff like that, it is just a ripoff, and there are other options than traditional health insurance, and a lot of people don't realize, but and medications are a perfect example too. Many times you are better off paying cash for your prescriptions and going through your health insurance because you just pay so much more with the copays and deductibles and all that. It is just crazy. We actually had an example. So in my book, I'm writing a book, and it's called Sickened, how the government ruined healthcare and how to fix it. It should be out in a few weeks, I'm hoping. I'm looking for a Christmas release. And we have a story in there about Janet, my wonderful wife, how we saved $5,000 by not using health insurance for a colonoscopy. Complete craziness. And we got way better service at the cash facility than we did at the facility that billed our insurance the first time we did it. So thank you for sharing that, Dr. Edgerly.
Yeah, that's true in our clinic. We have a whole network of services, whether it's a CT scan or MRI or lab tests, X-rays, ultrasounds, X-rays in our office, which we don't do, of course, but we have to call a service in. $75 for a 2-view chest or a 3-view ankle. Ultrasounds for $250.
What's an MRI?
CT scans for $500. MRIs for $600. Again, not in my office, but in facilities that do take cash, that recognize that you don't have to have insurance to take care of your health care.
That's amazing. Here's one of the things, too. So I'm going to guess that when you see that x-ray, you don't charge them a $300 reading fee either, do you?
I don't. The $75 actually allows me to read it on the computer screen myself, which family medicine does. But then within a couple hours, I actually give an official read, and that's all included for that $75 charge.
Amazing. That is so
amazing.
Cool. And so you're in Yakima, and you were talking about how you only got 2 calls over the weekend. For Thanksgiving weekend, so for 4 days you only got 2 calls at night. Is that correct?
That's exactly right. Sometimes I will go weeks without a call.
Okay, so
it's wonderful.
And you have 3 providers now, correct?
That's correct.
And how many patients do you have between those 3 providers?
Signed up, we have over 1,500 patients now.
That is crazy. That is so awesome. I am so happy for you. 1,500 patient load between 3 providers, and you're growing all the time. You're in a little town of Yakima. People are paying you cash, and you've been incredibly successful. Now, tell me, you used to take call for a hospital or for your clinic before, correct?
Right.
Tell me, when you took call overnight, how many calls would you typically get?
That's really interesting because the 3 partners that I was in business with, we had very few calls with us because we were pretty good at getting people in. But the average time in Yakima to get a physician now is about 9 days. And so the way our clinic is built, for example, is the patient is scheduled every half hour. That allows, and it doesn't take a half an hour to diagnose and treat, let's say, a kid with a strep throat. But that allows people to be added on. So we have like 40% same-day appointments. And we've allotted time for that. So therefore, the number of calls at night is less because you're getting people in today. You're getting them in now when they're sick, not 9 days after they've already had these symptoms.
That's good to know. So one of the ways you prevent so many calls at night is because you get them in quicker.
Exactly.
I see. Okay.
And that's kind of one thing that we promise is same-day visits.
That's awesome. So tell me a good story. Do you have a good story? And I've heard tons of them from you, but tell me a good story where you really felt good about the practice type that you've chosen, how you helped somebody, and it was a fun thing, and you saved somebody a lot of money.
Boy, there's a lot of those.
Yeah, right. So can you tell me?
I have one.
Okay, go ahead.
So I had a guy that came in, and he had severe shoulder pain. He had gone to the emergency room actually the night before, and they told him he probably had metastatic prostate cancer. The reason for that is he had prostate cancer diagnosed about 10 years before when he was in the state of New York. And then they sent him in, and he had this funny-looking shoulder, and that's what they thought he had. They called it lytic lesions, like little mice, bite holes in it. And so he came into my office, and obviously very fearful. And I said, well, hold on. Let me just make a couple phone calls in this 10 minutes that you're here in my office. So I called the radiologist, and he said, and he re-looked at it and said, yeah, it looks like little lytic lesions. I said, okay. So I hung up the phone and I called the urologist on call. And I said, hey, I got a curbside for you. And I talked to him about metastatic prostate cancer because I had just checked this guy's PSA, prostate-specific antigen, about a month ahead of time, and it wasn't high. So that concerned me. He goes, well, actually, metastatic prostate cancer is more bone, or they call it, rather than lytic lesions, it's more like extra bone is added. Okay? There's a word for that.
Okay.
Escaping my mind at this minute. So he said, I don't think it's prostate cancer with a normal PSA and lytic lesions rather than lesion of bone growths. So I hung up the phone and I called an oncologist. And he gave me some advice as well. Oncologists are people that treat cancer, of course. And so I was able, with 3 quick phone calls in a 10-minute period, get back to the patient and say, hey, there's nothing wrong with your shoulder as far as metastatic prostate cancer. We need to look at something else. And, of course, they did. And it was typically a variant of arthritis or something that didn't appear to be anything, or that eventually ended up not being anything at all. months to get all this done.
And not only take that time, but can you imagine the stress that you took off that patient because you were able to do something right then and there?
Yeah, that's even more valuable.
Absolutely. And I think that's one of the things we hear quite often in stories in clinics like yourself that don't deal with health insurance typically, is that you're able to do things like that because you don't have to jump through all those insurance hoops and be told by an insurance company where and when somebody can go. And because you, as a family practice physician, realize you've been trained to do many different things. You go ahead and take care of it instead of referring them on. So I think that's just super, super exciting.
Well, some of the insurance companies also, and I don't want to belittle them, some of them are very bad. I mean, if I see the patient and they have insurance and I say, you need a colonoscopy or you need this, I have to actually send them to a different physician. And that takes a month. And then that physician says you need the same thing I told them a month ago. But now they've had to, again, pay another copay and another deductible and wait a month to get into the physician. It's just a waste of time.
So tell us then, what's another option? And I do talk about this in my book, and I would like you to discuss it too. What's another option? If it sounds like you don't like traditional insurance, so what would you recommend?
People are under the impression, well, first of all, insurance is expensive because the government has mandated now that they cover everything. Our car insurance doesn't cover oil and gas and windshield wipers. Why is insurance trying to do that? Insurance should be just against the catastrophic things that are very, very expensive, not the routine office visits, not the routine medicines, etc. You can purchase health care for catastrophic care without using insurance companies. Now, they're usually called sharing companies or sharing ministries. 3 or 4 of the major ones started out as Christian organizations that everybody in the same church, so to speak, started saying, well, if, hey, Shawn gets sick, let's all share money and get him well, and if Rick gets sick, let's do the same, etc. But these are now nationwide, and they're not all of them are Christian or church-based. Many of them are just group-based, and there's hundreds or thousands of people on these plans. And I'm a member of one, for example. And so when I have a healthcare need, of course, if it's just an office visit, I pay for that myself. But if it's catastrophic, it goes into this group, and they pay for my healthcare. They pay for the lab tests and the ER visit, or I have a heart problem. Unfortunately, it runs in my family, so I'd had a heart attack. They paid for my visit to the cardiologist, etc.
That's wonderful. Yeah, that's one of the things we talk about in our book is those health sharing ministries. And like you say, they're not all ministries anymore. There's a few of them out there that are non-faith based, and so it gives more patients options. And it's incredible how much money we can save on those versus traditional insurance. So,
they're much cheaper.
Absolutely.
They're
absolutely
a couple $100 instead of $1,000.
And you get to pick your doctor.
You can find those on our website, for example.
Oh, perfect. And you get to pick your doctor too. That's another good thing
yep,
about it.
It's you're basically a free individual. You can go to whatever doctor you want. Your doctor can order whatever tests he wants, and those are all controlled.
Awesome. So in about 10 seconds, Dr. Edgerly, we need to wrap up and finish the show up. How do people get a hold of you?
Well, they can check us out on our website. It's called Assurance Healthcare. Well, our company is Assurance Healthcare and Counseling Center, because we do have counseling included with medical care, by the way. That's something that we have done that no one else has done. But it's assurancehealth.org, or our office number is 509-823-4650. 509-823-4650, or assurancehealth.org.
Awesome. Thank you so much, Dr. Edgerly. That last hour has been a blessing to us. And you've been listening to Health Solutions with Shawn and Janet Needham.
Thank you so much.
CMA, ACM, and Grammy.